So what's different about your approach?
Well, first we take more time with our patients, and with that time we counsel patients on improving their diet, on exercising more, and doing the basics that they need to do to lower cholesterol. Along with that, we'll prescribe nutrients that aid in lowering cholesterol. A lot of them are plant-derived compounds that are well researched. If after doing all that we can't lower their cholesterol levels, then we will prescribe statin drugs as a last resort, not a first resort. And then when we prescribe statin drugs, those drugs can deplete a crucial enzyme inside your cells called coenzyme Q10, and we'll be having patients take CoQ10 as well.
Okay, so we've got these issues with the statin drugs. Are there any natural remedies that we can use to help reduce cholesterol in the blood?
You bet, and one of my favorites are plant sterols. They're naturally occurring in a wide range of plants in the food supply, and they work great at lowering cholesterol in the gut. And then there are citrus flavonoids that are interesting. They're naturally occurring in the inner rinds of citrus fruit, but two of them are really potent at lowering cholesterol production from the liver. They're called naringin and hesperidin.
So could we just take our flavonoids and our sterols, bundle them together in a pill and get them out there to help people reduce their cholesterol?
Yes, you could, but the problem is that cholesterol is only one risk factor for heart disease. And in an ideal formula, you would have natural products that help to prevent the evolution of inflammation, that thinned the blood and reduced clot risk, and also lowered homocysteine. So what we've done is addressed all four areas and put them together in one product.
Now this is the product that you have worked on developing.
Yes, I have.
From your experience with these remedies. Why don't you tell us a little bit about it?
It's called CardioGOLD, and it uses plant sterols along with the citrus flavonoids, so we have really good natural product cholesterol control built into it, along with nutrients that prevent the developing of inflammation, as well as lowering homocysteine and keeping the blood safely thin.
So can you explain how these naturally occurring bioflavonoids that we find in CardioGOLD address the issue of cholesterol balance in the liver, which is where 80% of this cholesterol is being produced?
Sure, I can. Cholesterol is made up of a lot of different molecules. There's the good guy HDL, and the flavonoids raise the good guy HDL. The bad guy is LDL, and these same flavonoids protect LDL from being oxidized, and as it gets oxidized, it damages vessel walls. So it's really wonderful because they raise the good guy, they protect the bad guy from being oxidized, and as a result, the cholesterol gets transported and excreted from the body much more efficiently. They're really wonderful compounds, and they're the key ingredient in CardioGOLD related to cholesterol support in the body.
These citrus bioflavonoids that we have in CardioGOLD, are they the same as the flavonoids that I might find in my vitamin C tablets back at home?
They're really not. Vitamin C is pure ascorbic acid, and you may find some products that mix a little bit of bioflavonoids in with the vitamin C, but nowhere the concentration of these specific flavonoids to do the work that we need them to do. Also, the flavonoids that we use in CardioGOLD are pharmaceutical grade, they're patented, and they're exclusive in distribution in the United States.
These bioflavonoids do seem to be quite remarkable compounds. What else do we know about them? What studies have been carried out?
There's been numerous animal as well as human studies. Some focus on flavonoids reducing cholesterol, others on their anti-inflammatory properties, others on their antioxidant properties. And some studies even show their ability to prevent cholesterol from adhering to arterial walls, which is really remarkable.
It sounds incredibly impressive, and I understand you've got some pictures that shows this process in action.
Yes, we do. And as you look at these artery cross-sections, you notice that the red-stained fatty deposits are much reduced in the rabbit on a diet with naringin compared with the rabbit on a diet without naringin. These rabbits were on a high cholesterol diet for 8 weeks, either with or without naringin. These fatty deposits thicken the lining of the arteries, restrict blood flow, and weaken the arteries. In these views of the linings of the arteries, you can see that the red-stained fatty streaks cover much less of the surface area in the rabbits on a diet with naringin than without naringin. These reductions are attributed by researchers to genetic downregulation by naringin of adhesion molecules.
Okay, so we've looked at cholesterol as a major factor in heart disease. What are the other factors which CardioGOLD addresses?
There are 3 other factors. One is preventing inflammation, another is reducing the tendency of blood to clot, and the third is lowering homocysteine levels. What's wonderful about CardioGOLD is it addresses all of those plus lowering cholesterol.
Okay, so let's look at the next risk factor we have on our list, which is inflammation.
It's really interesting because some research shows that inflammation may be as high a risk factor for heart disease as cholesterol. And what's fascinating about that is there's estimated to be over 25 to 35 million healthy Americans who have signs of inflammation with normal cholesterol. So if inflammation is a risk factor, then this is significant, really significant, because we're talking about a lot of people. And you can measure the existence of low-grade inflammation in the body with a blood test called CRP, or C-reactive protein.
So what we're saying is that you could have a perfectly normal cholesterol level and yet, because of this inflammation, still be at risk from heart disease.
Exactly. And if you have high blood pressure, you're also at risk for heart disease. And there was a study that connected high blood pressure to inflammation. It was published in Circulation, which is a journal of the American Heart Association, that showed that women who have both high blood pressure and high CRP levels are at 8 times the risk for developing some kind of heart disease compared with women whose CRP levels are normal. And that's very alarming and important to address.
What causes this inflammation?
There are a lot of different causes of inflammation, and LDL can actually contribute. If the arterial walls get irritated from almost anything, inflammation can start in the wall areas. So high blood pressure can even be a contributing factor to inflammation. And a lot of times people have chronic infections, either bacterial infections in their mouth or in the bladder area, or they have chronic inflammation in their joints, and that can end up increasing risk for cardiac disease due to inflammation in other places.
Now, are there any natural ingredients in CardioGOLD which can help solve some of these problems?
Yeah, there sure are. The citrus flavonoids that we've been talking about are anti-inflammatory as well as helping to lower cholesterol. And in addition, there's white willow bark, which is the source of aspirin in the common marketplace, and we use the whole plant, which both reduces inflammation and also helps with blood thinning. But there are even more powerful anti-inflammatory herbal compounds in the formula. There's curcumin that comes from turmeric. There's devil's claw, which has been used for years in natural medicine. There's an Indian herb called boswellia and an extract of ginger. And they all work very synergistically, and there's been a whole lot of wonderful research on how these plants help to modulate inflammation and prevent it.
Reducing cholesterol levels, helping with inflammation. Those are two of the big risks that we've already looked at. How does CardioGOLD help with the third on our list of big factors, which is the blood clotting or blood flow issues?
It helps in 2 ways. There are platelets that are tiny cells in our body that tend to clump together, and the clumping of those platelets helps to form a clot. So we want to support healthy blood flow and prevent platelets from clumping and clots from forming. That's one area with a protein that's called fibrin and a blood test that's a fibrinogen level. And what fibrin is I like to use the analogy of a web of stranded protein between and around your cells. And if the web gets too thick, your blood clots. So not only do we need to reduce platelet clumping, but we need to prevent excess fibrin from stranding up and thickening your web, so to speak.
Right.
And as we do that, your blood stays thin and you have reduced risk of all sorts of problems, especially heart disease and strokes.
So what does CardioGOLD have in it that is going to address some of these blood clotting issues?
There are constituents that reduce platelets from clumping. One of them is white willow bark, another is garlic, a third is vitamin E, and we have enzymes that both help with platelet clump reduction. And enzymes are neat because they also reduce fibrin stranding that tends to happen. And one of the herbs that we have in the formula, curcumin, is excellent in reducing fibrin stranding. So they work synergistically together to thin blood in many different ways.
Right. So you've got these compounds in here that stop these platelets sticking together and stop them from getting tangled up as well.
And therefore, a clot doesn't form.
Okay.